This is KARK4 Today in high definition.
Back now at 5:42, many of us clench our teeth in our sleep, but sometimes that can lead to painful problems. Because Health Matters, we're joined now by Dr. Steve Mangan to find out when the pain can become a TMJ problem. I know so many people suffer from this, myself included, so I'm very anxious to hear what you have to tell us. Very common, right?
Very common. And the thing that most people get a little surprised about is that everybody grinds your teeth at night. You know, everybody grinds their teeth. And it's just that some people do it to the extent that it causes muscle spasms, pains, and problems. So I thought I'd go ahead and just take a little time to clear up a little bit about what is a TMJ. Well, TMJ is just an acronym for temporomandibular joint, and it's the jaw joint that we each have two of on either side of our jaw. And that joint is kind of a special joint because it's the only joint in the body that connects on both sides of the midline of our body. And we move it by rotating when we slightly open, and also we can stick our jaw forward so we can translate it forward. And so it's got a lot of special movements, and we use it all the time. Chewing our food, speaking, and as it turns out, we clench at night.
A lot of wear and tear on this particular joint.
A lot of wear and tear.
Is it normal to have a lot of popping when you open and close your mouth?
Well, the popping comes from as we have this little cartilage in between the jawbone and our skull up here. If the cartilage gets pulled forward, usually due to stress and a lot of grinding and clenching, then every time you open, you pop onto it and you pop off. If that happens a lot, you can have swelling in the joint. You can have other problems that really cause a lot of pain. And people come in to my office with headaches and muscle stiffness, a lot of problems that really give them some grief.
Yeah, I know. I mean, a night guard can work wonders if you have a really mild case, but what about these more painful, more severe cases? What can we do?
Well, we treat, gosh, all the way up to pretty severe cases with splint therapy. But it's really important that you get an accurate diagnosis, because there are a lot of things that can cause a TMJ problem. It could be trauma from like a car wreck, and there could be damaged structures that are really not going to be very easily repaired. It could be arthritis of your jaw joint. People have problems with the capsule that I was just discussing a minute ago, the little cartilage getting pulled forward. And so getting a correct diagnosis and getting a treatment that fixes that problem is really essential.
Really want to get a professional to look at it. Don't self-diagnose. And don't walk around in pain if you don't have to.
Yeah, absolutely. Let's know.
Thanks so much, Dr. Steve Mangan. We appreciate that information. And